Food is not just calories, food is information. It talks to your DNA and tells it what to do. The most potent fast to change your environment, to change your health and your entire world actually lies with your fork. Those are the words of Dr. Mark Aman. My name is Talani Fasho. I'm coming to you live from Union Television. And celebrating the World Diabetes Day. What are the things that we need to know about diabetes? In January 11, 1922, the 14-year-old Leonard Thompson became the first person to receive an insulin injection as treatment for diabetes. And within 24 hours, the dying sickly child with increased high levels of blood sugar became so normalized, so much better health wise. In less than 24 hours, his sugar level became normalized. And prior to that, people with type 1 diabetes, they did not survive for few weeks after or months after the diagnosis of the disease. So what is diabetes really? And research reveals that over 500,000, about let's half a million, 500,000,000 people, like 5 to 7 billion people, like between the ages 20 to 79 years, are living with diabetes. Every 1 in 10 persons is living with diabetes. And the number is predicted to increase to 643 million by 2030 to 783 million by 2045. In fact, research is revealing that 1 in 2 persons do not even know that they have diabetes. Likely do have it, but they don't even know. All right, so let me start with this. Dr. Kido, can you just shed light on what diabetes is? Celebrating the World Diabetes Day. There are many misconceptions. Some would say diabetes is death sentence. When they hear it, is as if they have it, it's the end of the world. But we are aware that you've been managing a lot of patients that have this disease effortlessly. So can you define it? Can you explain what we need to know about diabetes mellitus?
Okay, thank you, Talani, for having me on your show. Diabetes is not a life sentence or a death sentence. Diabetes is it's a chronic condition. And just to use layman's terms, just for the sake of our audience who are not in the medical field or clinically aligned, diabetes just means that there's too much sugar in the blood, and the body is unable to manage this sugar. So the sugar gets into places it shouldn't, and as a result, it causes the complications of diabetes. So diabetes is a clinical condition, just to be able to define it, in which the body is unable to metabolize glucose. And then this glucose gets in the blood. That's where you have the high blood glucose, where they check and the blood glucose is very high. And so it remains in the blood. And in the process, the body tries to reduce it. And then as a result, you have you have the symptoms of diabetes that were so common. We know about that. People begin to urinate a lot, they're thirsty, they're drinking lots of water. So it's just the body's inability to metabolize or to glucose. So glucose is usually our bodies, the food we eat gets broken down into glucose, blood sugar. And this sugar gets transported from in the blood to the cells where it is needed for energy. The transporter of glucose is insulin. And then there's so diabetes arises as a result, not because of the glucose, but because there's a problem with insulin. Insulin is either not enough or is ineffective. So some people have either they don't produce insulin, or they don't produce enough, or at the site where the insulin should work, it's ineffective. There's some resistance.
Okay. I wanted to ask this for you, Christy. I wanted to ask, what are the signs? How do people know? I still hear some people talk about the traditional you will be on the floor and then we wait to see if hands will gather around. Are there more modern, or what are the signs? How can people know that, okay, I've urinated up till 5 times today, so it means that I have to go check my blood sugar? Is there a way people can know what are the signs of the presence of diabetes in someone's body?
So, yes, not to discard the um, non-formal way of diagnosing diabetes, but nobody usually urinates. We have more modern ways of passing urine now,
Yes,
and
they
then
say
wait for
traditional. Used to hear it back then
traditional,
in the villages. Yes.
and then wait for ants to gather. So most times people come and say, "Oh, you notice that they've been passing urine more frequently than they usually do." And they may just try and go, I've been drinking lots. They think, oh, I'm doing water therapy. I'm drinking lots of water. They say water is good, or and or so one of the symptoms is that they're urinating more frequently. So if you were passing urine, maybe waking up once or twice at night to pass urine, and then it's like 5 times, 6 times, 7 times, you're waking up, your sleep is interrupted. Anybody will take note and say, oh, there's something wrong. And then, like I said, just because you're passing out urine, you become more thirsty, and then you drink water. So people who are like drinking up to 3 liters of water, taking pure water sachets, and they're just drinking it. Some people may ascribe it all to the weather, and then they're always thirsty. Their mouth is always dry. So those are the symptoms. Those are the simple symptoms. Just increased urination, excessive thirst, and drinking lots of water. Some people lose weight. Some people they come in as an emergency, so they don't even go through all those symptoms for a long time. And some other people don't just have any symptoms; they just come for a routine check, and they're told that, oh, sugar is 200. I'm like, oh, I didn't know anything about that.
And if there is anything I gained from this discussion, like what were the major things?
Well, the major things I got from this is that it can be managed. It can be managed, and people that want to go for alternate cures, alternate medicine, well, I don't see that giving the best
They
cure.
should be careful.
Yes,
They should
exactly.
be careful. For me, I would say over and over again, diabetes is not a death sentence. Having it doesn't mean the whole world is ending for you. Many people manage diabetes and they live to their 70s. All you need to do is to have your physician, get a registered dietitian. You would need them because they have to manage your dietary intakes. You could even have a fitness person because exercise is very, very important. If you're able to do all of that, you could manage it. But like I say, like they always say, and the saying goes that prevention is better than cure. It is better if you know it runs in your lineage. You had one great grandfather that just went blind and they didn't know why he went blind. Remember, one of the complications of diabetes is retinopathy. That is pathology of the retina. You could try to find out. Apart from that, did Baba have any other issue? Was he always urinating? Find out and then go for screening. And immediately you know that there are traces. Then you have to be careful. You can't be taking bottles of Coke every day. But although we know that it is not necessarily about the bottles of Coke, really.
Absolutely.
Yes, that is another different story for another time. But you should be careful with if you have sugar tendencies, you shouldn't bother around frivolous use of loose sugars. Shouldn't bother around being overweight. You eat the burgers on the fries and just and ice cream on the shawarma. You just eat anyhow, and then your body is getting sick and sickler, even though you look like a big man or a big woman. Because in Africa, we believe when you are fat,
When you're eating and you're fat, and
a
then
sign of good living, and that isn't true. So I hope we hope you enjoyed this little discussion we have on diabetes. And like my co-presenter said, we are still coming back. This is not all we're going to have. So stay tuned, stay glued to Union Television. You can follow us at Union Television 1 on YouTube, Instagram, Union Television on Facebook, TikTok, and at Union Television, oops, sorry, beg your pardon, at Union underscore TV1 on Twitter. And I remain fashion with you, Tolani, and
I am Musa Christopher.
bye for now.
From the lower to the highest intensity. So we are moving to the second sequence, which is the dynamic stretches. So how do we go about that? We start from the upper to the lower extremity, from your waist down to your feet. You take it down. Ensure you do not bow your head. You bring it down this way, then you touch your waist. Are we ready? 1, 2, ready, go. Good job. 9, well done. 8, 7, 6, 5, 4, 3, 2, 1. Well done, everybody. Now the next one, you take your right hand up this way with your left hand right directly to your waist. Now you're taking it right to the side and back. Ready? 1, 2, ready. You take it this way, sideways and back. Good. 1. That was for your lateral plane. 2. Good job. 3. Well done, everybody. 4, 5, 6, 7, 8, 9, and 10. Well done, everybody. So now we are repeating the same thing to the other side. You take your right side this way while you take your left hand up. So we are taking it to the other side. After the count of 3, 1, 2, 3, go. 1, good. 2, well done. 3, good. 4, 5. Ensure your hand goes above your head. 6. Do not take it right this way. 7. You're cheating. You take it this way. 8. You feel the extension right here. 9 and 10. Well done, everybody. So now what you're doing now, we're going on back lunges. How do we go about that? Your right leg, you extend it directly to the back. Then you bend to the back in your own little way. I have to show you from the side. You take your right leg this way. You bend to the back in your own little way. You bring it forward. You take it to the back. So we're starting with that. After the count of 3, we're going to start. Ensure your hands goes up, then you bring it down. Bring them down. Ensure you straighten your hands. After the count of 3, 1, 2, ready, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Well done, everybody.